Hello, Gwen.
Hi.
Welcome back.
Thank you.
It's been about 9 months now that you had your facial surgery here in this clinic, and I have a few questions.
That's fine.
The first one is, which problems did you have that made you decide to have facial feminization surgery?
So I suppose it's the typical ones. I had major dysphoria with my face. So pretty much from pretty early on when I had realised I was trans, so I only realised in my early 20s, 26 now. So I just pretty much from then I'd already had gone through the fun stuff of male puberty and the effects of masculinization, I suppose, on the face. So heavy brow bone, quite large jaw, stuff like that. So I was already very dysphoric about it. So I very quickly started researching facial surgeons and options that I could go for if HRT wasn't sufficient, I suppose.
Mm-hmm. And what made you decide to choose for this clinic?
So I looked at most of the clinics that were reputable around the world, basically. Very quickly I ruled out the American ones because they're stupidly expensive. I mean, just the hospital fees alone make them much too expensive, and obviously traveling makes it a bit tricky. So no, I looked, then I tried a few in Europe and stuff like that, but I felt here was good reviews. The bone work I felt was very good as well. The work, it was natural looking, but also not too conservative. I found some places was very subtle looking, which is fine for some people, but again, as I said, I had quite heavy dysphoria, so I would want like the most done as possible, I suppose, without causing damage to you. That was kind of my logic, in a twisted way, I suppose. So Dr. Bart's work kind of caught my eyes over and over as I was going through, sort of thing, and then consultation just kind of solved it for me. He just kind of said what I wanted. That's about it. No fuss, no drama, just this, and I was like, cool. Yeah.
And can you tell us something about the results?
So definitely, since I've had, I mean, obviously there's background stuff going on at the same time, but in the period after I've had facial surgery, I started full-time presenting as female when I would go out. Before, I was very much in that stage where I kind of go, dress more androgynously and kind of push the limits a teeny bit, but often kind of chickened out of it, I suppose. But after facial surgery, I just started getting, I felt like I stopped getting odd looks or anything like that, and just started going about and being treated as myself, So I felt very quickly the confidence built, I suppose, and I think that is from the facial surgery. And then 2 months after I had the breast augmentation as well, so I think that kind of completed the silhouette or the overall look. So I feel like I pass very well now as I go around, and that's made a huge difference in terms of my transition. I feel like I'm in a very good place that I can just go out and not have to worry about that aspect of my life when I go around, if you get me. So obviously I have anxieties and stuff like that, but in terms of me being trans and people having an issue with that, I feel like it's unlikely I'll be clocked, and I haven't been since, I suppose. Yeah.
Good to hear. I turn a little bit to you because you said something interesting a few minutes ago.
Gwen, we went back to South Africa after Christmas. I'm Gwen's mom, and it was the first time my sister and nephews and friends in South Africa met Gwen as Gwen, and they were absolutely blown away by the changes that the facial feminization surgery did. It was really, I think it is amazing.
Yeah, but I mean, it's just that sort of just in general, the overall from that and the benefits of transition just means I was able to be myself when I was there, and I think that's what came across. Last time I was very closed off and, wasn't present, I suppose. This time, in everything included, especially the facial surgery, helped stay on track.
I think it boosted your confidence.
Yeah, I think
that.
I think it started off with the boosted confidence. Once I had the facial surgery, because I was, social dysphoria was quite high, so that helped me to start easing that, and then, as with most things, once you take the first few steps or have the first easing of the pressure, it all becomes easier from there. So I think it was just what I needed to get everything else sorted out as well,
People will be very interested to hear a little bit about the healing. Can you tell us something about that?
Yeah, so healing wise, I mean, so the first week is generally the toughest because I had jaw surgery and chin surgery, as well as forward reconstruction and such. I had a cast basically on the jaw, so for the first week, while the pain was pretty well managed, I think, by the medication I was given, it was maybe just a little bit harder to do that, just normal things like brush your teeth a little bit or chew food. But once that was gone, it was pretty easy to get back into normal routine in that regard. Still a little bit of pain from the incisions, so just eat soft food and stuff like that. But no, not really that bad. I mean, like, the swelling obviously is quite bad in the first days, and your voice will be hoarse, and it's hard to see, just because your eyes are swollen if that happens to you. But really, I mean, like, you're plenty to complain about in the first few days, but it's not like major complaints. It fades quickly, and looking back, it's hardly a big ordeal at all, honestly. After that, the bruising was gone. There was quite a lot of bruising around the eyes and just below. That was gone maybe 3 weeks, I suppose. It was fully faded, but it wasn't too noticeable before then. The scars, I felt the tracheal shave incision, it's pretty much entirely gone.
Mm-hmm.
The scar on my forehead is nearly entirely gone as well. It might get a little bit red if I rub it sometimes, but that's just maybe because it's a more active area, I think, where I'm messing with my hair. But other than that, it's completely not noticeable from what I've seen. I mean, when I ask people, they don't seem to notice it, so that's good. Sensation, there's definitely a loss of sensation in the chin area and forehead, back to the back of the scalp. And for the first months, I suppose, the forehead and scalp came back, I think, pretty much completely within the first 3 months. The chin started coming back around 3 months, and over time it's been slowly gaining sensation. So it's still a little bit speckled or a little bit different how it was before, but I can tell that I'm touching there, and it's perfectly fine, really.
Mm-hmm.
Yeah.
You also stayed a few days in the guest house.
Yeah.
Could you tell us something about that?
So the guest house obviously wasn't the primary focus when I was looking for a surgeon, but it turned out to be, I think, without thinking about it, like, I mean, some of the places I was looking, they would keep you in hospital for 2 days, and then you'd have to go back to wherever you're staying, a hotel, and you'll get taxied around, which is fine, but as I said, like, the first few days it was very hard to see and to eat and stuff like that, so being able to be in the guest house where I could essentially just be catered to and looked after was a huge relief, because I was there for the 7 days until the cast was taken off, basically, was the timeline. So all the meals provided, and the room's really nice and comfortable with temperature control and stuff like that, so I didn't really want for anything, I suppose would be the best way to put it. So I felt that was just really nice thing to not have to worry about, because definitely having to move about when you just had surgery isn't something I wouldn't be nervous about. I'd be a bit unsure about doing that, so it was nice not to have to worry about that.
Mm-hmm. If you could give yourself as you were before the surgery, if you would be able to give yourself an advice, would you have one, and what would it be?
Just before surgery?
Mm-hmm. Would you do something different?
Oh, I see. No, I mean, I'm pretty sure there's nothing really that I regret from the surgery. No, I think everything there's nothing. It's all. Yeah, there's nothing I would take away for sure. No, I think it's all positives. The work that I chose to have done, I'm happy with each individual thing. So tracheal shave, jaw, eyebrow lift, all positives. So nothing negative at all.
Okay.
Yeah.
So I would. Last question: if someone that is interested in having surgery with us and would like to communicate with you by email,
mm-hmm.
would you be willing to do that?
I'm happy to share the experiences. It can be hard to find, accounts just, I suppose, of the day-to-day of surgery, and outside of just a quick opinion about the consultation, if you get me. Mm-hmm. So it's good to have, if I had someone to talk to about the full experience at each of the places I was having a consultation at, it would have helped to build a picture. So if I can do that for someone else, I'd be happy to. Yeah.
Okay. Well, thank you, both of you, very much for the interview. It was nice and extensive.
Good.
Very informative.
Great. Thank you.
Thank you.